3 signs of spinal stenosis and a proven treatment naturally without surgery to stand longer, walk, and get past your pain. Let's jump in. Number 1, it's called the shopping cart syndrome. Why? Because you will lean forward on like you're on a shopping cart, or you'll see someone in the store, Costco or Safeway or Trader Joe's, and they're leaning forward because it's flexing the spine, it's creating space, and that's taking pressure off of the nerves and the spinal cord. Number 2, standing makes it worse, either the low back pain or the nerve pain, and then sitting makes it better. Sitting is good, standing is bad. And number 3, there'll be some type of nerve pain down one leg or down both legs. Could be a sign of stenosis. Those are the 3 signs. So spinal stenosis, there's 2 types. We'll break down each. We have central canal stenosis. So for the viewers, I'm showing you, we're looking above it, so from top down, and there's this hole right here. This hole is where the spinal cord is. That's called the central canal. That's where your spinal cord lives. And then if we open it, you can see here these nerves. That's where the nerves exit this canal right there called the foramen. Stenosis means the closing of those holes. So central canal stenosis will affect more of the spinal cord, where foraminal stenosis will affect one nerve. How does it happen? It takes 10, 20, 30 years to happen. There's a lot of pressure and compression. Could be from manual labor, it could be from sitting a lot during work, it could be from long commutes over long periods of time, types of exercise you're doing. There's lots of factors. And what happens is, as our bodies are under more stress, Wolff's Law states that when your body's under stress, it'll combat that stress and it'll produce more bone, more calcium deposits on those bones. So it's a stress in our system over a long period of time. What happens is there's an inflammatory response now, and those nerves get affected, and that's what causes the radicular pain. How does leaning forward help this? If we look here, if you lean forward, it takes pressure off of the canal. It widens the canal slightly, and that may be enough to alleviate some of the inflammatory response and some of the nerve pressure. That's why shopping cart syndrome is a telltale sign of stenosis, because when you lean forward, you flex, it relieves pressure, it feels good. How would spinal decompression work with stenosis, whether it's foraminal stenosis or if it's how would decompression help? Think of this as a highway. This highway right here is clogged, it's jammed, there's a traffic jam. Decompression is not going to remove the cars and free up the highway. It's not what it's going to do. But through a traffic jam, if we can just open one lane, 5-lane freeway, all clogged. If we can open up one lane and get some cars moving, it will slowly improve the traffic jam. So what happens is, if we can get the right angle and flex the spine, and because that's the flexion is what creates space. That's why shopping cart syndrome, you flex forward. We're going to do the same thing on the decompression table. We're mimicking the relief of the symptoms. So if flexion's good, we're going to really flex you on the table. Literally, you're laying on the table, your legs are flexed in the air to create a flexion of the spine to relieve pressure. We're opening up just one lane on that highway system. When I can open up one lane and pull and release pressure on that disc and that central canal, and we can allow oxygen, nutrients to the disc and to the joints, it frees up a lane. It may free up 2 lanes. I'm not going to clear the highway. I cannot fix the stenosis. Can't remove the bone. So I tell patients it's 50-50. If I can open up enough and stretch you enough to reduce enough inflammation and irritation to those nerves, there's a great chance we can get success. And that's how it works.